Hi, everyone. Welcome to DFEND. This meeting will be recorded. You may have heard that just stated. My name is Jamie Baum, and I'm an associate professor in the Department of Food Science, and I direct the Center for Human Nutrition within the University of Arkansas. With me on the call are Dr. Erin Howie, who directs the Exercises Medicine program, and Angela Tassinelli, who's our scientific communications person. This is week 3 of DFEND. For those of you who are just joining us, you can find our previous weeks on our website. So how DFEND works, for those of you just joining, is we have this weekly Zoom call focused around a topic, and the full agenda can be found on our website. And we supplement the oral sessions or these presentations with key fast facts, which can be found on our website. And Angela will share those links with you. And we also are recording each session and putting it on our Zoom or our YouTube channel. We can share the link to that. So we hope to have everything posted from each Friday by the end of the day on Monday. And they'll also be archived with Scholar Works at the University of Arkansas. So thank you for those of you who've signed up for our newsletter. We'll use this listserv for our regular callers to remind you to register. So each week you have to register using the same Zoom link to be able to call in. And and so if you miss something, it will be available digitally. So we appreciate all of the interest. We did have a previous DFEND session for those of you who are new to pilot this concept. So you'll find also a bunch of fast facts and lectures from our more open forum with tons of recipes, things about food safety, and other topics. So I do tend to talk fast. So Angela will be monitoring the chat. So if you need me to slow down, I can't see the chat, but she can read it and she can help answer questions as we go. This week, our topic is healthy eating patterns. And then next week, our speaker is Dr. Howie, and she'll be introducing the Exercises Medicine program. And then you may, my email keeps dinging, so let me turn that off. But also, you'll notice when we send out, to those of you who signed up for the newsletter before like 10 a.m. this morning, you'll see on our website, there's an opportunity to take a pre-assessment. So we highly recommend that you fill out this pre-assessment. It asks things about, diet, health, physical activity practices. And as long as you put your name and email address on the final question, we'll be able to save that information and condense it and share it with you. And then we'll also be able to compare how your responses changed when we do a post-assessment in December at the end of the course. So it should take you around 10 to 15 minutes, and we encourage you to fill out this assessment after the class. So we'll go ahead and get started because we try to keep these to 30 minutes for a nice little lunch break. Let me share my screen here. And yeah, so today, let me put this in. We'll be talking about healthy eating patterns. So we have 5 learning objectives for today: to define eating patterns, understand what makes up a healthy eating pattern for the United States, some examples of healthy eating patterns, how to incorporate a healthy eating pattern into your everyday life, and the importance of healthy eating during the COVID-19 pandemic. So all of the information presented in these slides has been taken from either mostly from the dietary guidelines. In 2015 is the first year they shifted from like a pyramid, or no, that was 2010, but 2015 is where they made a focus on healthy eating patterns. So focusing on what is in our diet and the changes we need to get there. So what do the dietary guidelines define as a healthy eating pattern? So it represents the totality of the foods and beverages we consume. So it's all forms of food, so fresh, canned, dried, processed, frozen, can be included in a healthy eating pattern. It also includes foods and beverages. And it really recommends that our nutritional needs should be met primarily from the foods we eat. So we should target meeting our nutrition needs through our healthy eating patterns that include nutrient-dense foods. And last week, I think we addressed nutrient density a little bit, but that's making sure you have more nutrients per calorie. So something that's nutrient dense would maybe be like a piece of fruit where you'll have a lot of vitamins, calories compared to the calories present in that food. Whereas something like a candy bar or like a sugar sweetened beverage will have a lot of calories, but not a lot of nutrients. And it's important to understand that these healthy eating patterns are adaptable. So there's more than one way to have a healthy eating pattern. And eating patterns can be tailored to your sociocultural and personal preferences. So basically, this is a shift in mindset that happened in 2015 to include everybody. So every eating practice can be adaptable to a healthy eating pattern. And the 2020-2025 dietary guidelines are expected to come out in December. So it'll be interesting how they further shape these ideas. So what are our current eating patterns in the US? So this comes from the Dietary Guidelines Committee, and you can see everything on the left side of the screen. So bars that are orange are things we are below the recommended limit or above the recommended limit. And then the blue is intake at or above the recommendation or below the limit. So you can see we're really strongly bad at not eating enough fruits, vegetables, grains, dairy, protein, and oils. So these mean like healthy oils. And we eat way too much added sugar, saturated fat, and sodium. So you can see that we're not doing the best job. So around 80% of our population doesn't get enough fruit, vegetables, or dairy products. And you can see that very few of us meet the dietary intake for these healthy foods that are part of a healthy eating pattern. So this is just another way to show that figure. So how well do we as Americans adhere to our dietary guidelines or stick to the recommendation? So this includes data from people ages 2 and older, and this is from the 2010 dietary guidelines. So you can see that in 1999 to 2000, around 50% adhered to the dietary guidelines. And then around 10 years ago, around almost 60% of us were adhering to the guidelines. So we're getting better, but we're not great. And then Dr. Howley will probably talk more about physical activity in the next 2 DFEND sessions. But this just also shows that not many of us are meeting our physical activity guidelines. So you can see in 2008 to 2013, we did improve a little bit as a general population, but only around 20% of adults are meeting the physical activity guidelines. And you can see this percentage decreases as we age, so there's definitely some work to do here. So when we talk about changing our eating patterns, it can be overwhelming. So I mean, a lot of reasons that the weight loss industry or diet industry is a billions of dollars a year business is because making change is hard and deciding what changes to make and sticking to them can be challenging. So it's important to know that every food choice is an opportunity to move toward a healthy eating pattern, and it doesn't have to happen all at once. So making small changes over the course of a week, a day, one meal can make a big difference. So just swapping out like high calorie snacks like chips or candy bars or brownies for more nutrient dense snacks, swapping out fruit products. So this would be like fruit juice or processed fruit products with added sugars for whole pieces of fruit, whole grains instead of refined grains, eating oils. So oils are fats that are liquid at room temperature versus solid fats like butter, which are solid at room temperature. And switching out beverages that are high in added sugars, so this would be things like sodas for no sugar added beverages or water, are all small choices you can make for healthy eating patterns. So there were a lot of science went into these dietary guidelines to figure out what a healthy US eating pattern would be. So I wanted to share this slide because there's so much nutrition information out there on the internet and on social media, and not all of it is driven or guided by science. So in order to establish what a healthy eating pattern is for the dietary guidelines, they did a systematic review of scientific research. So this is really when scientists scour the literature. So we're talking tens and thousands of published papers to look at specific relationships between diet, foods, beverages, and health outcomes. They can also do food pattern modeling. So they use existing food intake data to model the type of diet that generates healthy outcomes. And they looked at current intakes to identify areas of potential health concern. And so these associations can be strong, moderate, or emerging. So strong evidence really shows that a healthy eating pattern is associated with reduced risk of like cardiovascular disease, type 2 diabetes, and obesity. There's a lot of strong evidence for that. There's moderate evidence that shows that healthy eating patterns are associated with reduced risk of type 2 diabetes, certain types of cancer, overweight and obesity. And there's emerging evidence that suggests that eating patterns may have some may help with some neurocognitive disorders and congenital anomalies. And in DFEND 1.0, and I think in previous weeks, we had talked a little bit about the MIND diet. And so this is where, that evidence would fit in, where people following sort of a MIND type diet have shown cognitive improvements. So this figure is a little bit blurry, but you can Google my plate and you'll find a million images for what makes a healthy plate. So when we're implementing a healthy eating pattern in our life, our healthy eating pattern should support a healthy body weight, and they can help prevent or reduce the risk of chronic disease throughout our lifespan. So during growth, development, aging, as well as during pregnancy. And this is important because really over the last 10 to 15 years, they've been able to establish that what women eat when they're pregnant can actually sort of metabolically imprint their offspring and determine their offspring's risk for disease later in life. So the one thing I like about my plate is the really good visual for how to build your plate when eating meals or eating out. So really half of your plate should be fruits and vegetables. A quarter of your plate should be grains, and half of the grains you eat per day should be whole grains. And then a quarter of your plate should be protein. So we should be eating a variety of vegetables from all the subgroups. So there's several subgroups of vegetables. So these are like our dark green veggies, red and orange veggies, beans and peas, starchy veggies like potatoes. And these are important because it's also shown that the color of your fruit or vegetable skin may have these things called phytochemicals or phytonutrients that provide additional health benefits beyond nutrition. We should focus on fruits, especially whole fruits, whole grains, fat-free or low-fat dairy, and a variety of, I would say, lean protein foods. And these can be things from like lean meats all the way to nuts and seeds, and then healthy oils. So they did show in this last set of dietary guidelines that Americans aren't consuming enough healthy fats. So those are things like omega-3 fatty acids. So this is the first time since the inception of the dietary guidelines that they removed the limit on fat intake to increase healthy oil intake. But there are limitations, so foods we should watch out for a healthy eating pattern. So you want to consume less than 10% of your calories per day from added sugars. So last week we talked about how to calculate 10% of your calories per nutrient. So sugar would be a carbohydrate, and Angela has a fast fact posted on our website as a reminder. You should have less than 10% of your calories per day from saturated fat, consume less than 2,300 milligrams of sodium per day, and if you do consume alcohol, consume so in moderation. And so how do you figure out which nutrients are in the foods you eat? So we really need to start paying attention to the nutrition facts label. And so paying attention to the actual serving size. So this serving, there would be 8 servings in the container, and a serving size would only be 2/3 of a cup. One food group that this, or one food product that this is important, I always think to pay attention to is cereal. So if you look at your nutrition facts panel on your cereal box and what the actual serving size of cereal is, that's a place where people may overconsume calories. It tells you the calories, but then you can see here which percentage of the daily value are your nutrients meeting, or is this product delivering? So you can see this product is delivering 10% of total fat and 5% of total saturated fat based on the 2,000 calorie diet. It tells you about your sodium intake, total carbohydrate, and added sugars. So it's important to check out your label for integrating foods into a healthy eating pattern. So there are many different eating patterns. The ones that are highlighted in the dietary guidelines include this US style eating pattern, and it's based on types and amounts of food that Americans typically consume. So this would be a variety of veggies, fruits, whole grains, fat-free or low-fat dairy, seafood, lean meats, eggs, nuts, seeds, and soy products. They also refer to the healthy Mediterranean style eating pattern because this is one eating pattern that has been well established to be associated with lower chronic disease risk. And then the healthy vegetarian eating pattern. So this eating pattern does not contain meat, poultry, or seafood, and it contains more soy, eggs, beans, and peas. So the dietary guideline document is really easy to read, and I suggest flipping through it if you want more information. So how much should we eat at different calorie levels? And this basically refers to cups or equivalents. So this refers to the amount of nutrients within the food and how it compares to recommendations. So you can see that it breaks it down between 1,600 calories, 2,000 calories, and 2,400 calories per day, and how much of each ounce equivalent you should have per day. And you should really vary your protein foods per week, but each day it talks about the ounce equivalents that you would need and how many calories are left over for other uses, maybe things like snacks. And then this just goes into the different styles of eating patterns. And Angela has made, on the previous slide, Angela has made a fast fact about that. But talking about the servings you would need of these different food groups for the US style of eating, Mediterranean style, and vegetarian style based on the 2,000 calorie limit. So you can see that vegetables and fruits and whole grains stay the same. And then what differs is maybe where your protein sources are coming from. And this is just the Mediterranean diet pyramid. This actually turned out to be a little bit blurry on my screen. But you can see one big issue or difference with the Mediterranean healthy eating pattern is that physical activity and enjoyment of the meal, so incorporating others into your meals, forms the base of the eating style. And you can see that meats, like red meats and sweets, are at the top, so you should eat those sparingly, which is a lot different than what we see in the United States. Just check the time, okay. And there are lots of opportunities, we talked about this earlier, to shift your food choices. It's important because it can help support a healthy body weight, meet our nutrient needs, and reduce our risk for chronic disease. This is especially important during social distancing and COVID-19, where maybe some of us are becoming a lot more sedentary than we used to be, or we're eating for convenience, or a lot of processed foods, and shifting away from healthy eating options. And an eating pattern is not an immediate thing. It's really a result, it's the big picture. It's the result of choices of multiple eating occasions over time, both at home and away from home. So I think you shouldn't judge yourself based on one meal, but maybe based on the meals you chose or the foods you chose over an entire day or week. So this just talks a little bit about how we currently eat in the US. So the majority of the United States population consumes 3 meals a day plus more than one snack. So it says that children ages 2 to 5 are more likely to consume 3 meals a day, and 84% consume 3 meals a day, and most often 2 or more snacks. And in contrast, half of adolescent females and young adult males consume 3 meals a day, but also have 2 or more snacks per day. And then among most age groups, 40 to 50% consume at least 2 to 3 snacks a day, and 1/3 consume 4 or more snacks a day. So you can see right away that snacking is probably an easy way to start improving our eating patterns. So around 2/3 of the calories consumed in the US are purchased from a store, like a grocery store or supermarket, and consumed in the home. but we've increased the amount we consume away from home, at least pre-COVID-19, from around 18% in the late 70s to 33% in 2009 and 2010. And my guess is that this number would be even higher pre-2020. So what drives our food decisions? So really there's a social ecological model that they talk about in the dietary guidelines. So it's things about us as an individual. So we can motivate change at the individual level by increasing our knowledge or influence our attitudes or beliefs about food. Groups or interpersonal influences can change our food decisions. So we tend to eat more if we're in a group and they're all eating more, or if they're making bad choices, we tend to make bad food choices. So just an organization, so policies within an organization can influence what we eat. Our community, our religious beliefs can influence what we eat, as well as public policy. So we do have to meet people where they are. Not everyone can switch to a healthy eating pattern right away. We really need to take into consideration food access. So making sure all people have access to healthy, safe, and affordable food choices. And this can be accessed by or impacted by a lot of factors. So how close are people to the store? What are their personal resources for the purchase or obtaining the food they need? What's available in their neighborhood? Also race, ethnicity, socioeconomic status, our location, or having a disability can also impact our ability to access safe and healthy food to support healthy eating patterns. And I think we see a lot of this in Arkansas, especially now during COVID-19. So we can think of ways within our community to ensure that the people who need it most are able to adopt a healthy eating pattern. We need to consider household food security. So pre-COVID-19, around 48 million people lived in households that experience food insecurity. We know that number is increasing. It can be temporary or persist over time. I expect with the unemployment benefits that are ending today, we'll see this number go up in Arkansas. So we have to challenge ourselves to think how we can help with food insecurity. And we have to take into consideration people's culture, so attitudes, values, customs, beliefs that may also influence their dietary habits, and that these can all be incorporated into a healthy eating pattern. So I'm almost finished, so we'll have time for questions and discussion. So really, in order to shift our current poor eating patterns to those that more closely align with the dietary guidelines, we need action from all segments of society. So from the individual to the policy level, and our families and our communities. And we really need to work on identifying and addressing successful approaches for change and knowing that this approach can be different for each person. And then this is something I took from, actually, Harvard has a great nutrition blog, and it talks about how to maintain a healthy eating pattern during COVID-19. So making a schedule or a daily meal plan. It's more predictable. It may prevent snacking. Skype, Zoom, or FaceTime with family and friends. So like we said, one part of the healthy Mediterranean eating style is eating with others and enjoying the foods you eat. So connecting virtually may help. Plan for your groceries to buy fewer processed, high salt, or high sugar snacks. Load up on fruits, veggies, whole grains, healthy fats, and lean proteins. Save money by skipping high sugar soda and juices and consume water. And Angela will make some demos when we're talking about hydration in a few weeks with ways to sort of spice up your water. Plan and enjoy an occasional comfort food. I mean, as Americans, it shows that we eat like 3 to 4 snacks a day, some of us. So plan for it and just try not to eat all your favorites on the same day, and manage your environment. So I know this is something I have to do for my favorite foods. If they're not in my house, I can't eat it. So if it's not in your cupboard, then maybe you just can't eat it. So just to quickly summarize, hopefully you took away something about eating patterns and what makes up a healthy eating pattern, some examples, and understanding how to incorporate a healthy eating pattern into your life, that it doesn't have to happen all at once, but can happen with slow change, and the importance of eating healthy during the pandemic. And we'll continue to incorporate this concept into all of our lectures. So let me stop sharing my screen and we'll open it up for questions or comments, concerns. Angela, were there anything? Oh, enter the Harvard blog in the chat. Let me get back to my slides here.
I have a comment. This is Pam Pruitt. I want y'all, these resources are so great for your little radio programs and posts. And so I got a radio program off one, and you just want little short blurbs of good information, and it's just a wealth, I think, of information. Thank you, everybody, on this project.
Thanks, Pam. It makes us feel good when we get your emails, because it's happy to know that people are finding it useful and able to use the materials. And I think Angela has become a fast fact guru with making these. And also the Division of Ag Communications team has done a great job in converting our stuff for social media. And especially for agents, if there is a topic that you don't want to wait for us to be covered and you need a fast fact, feel free to reach out, because we can make some specialized, at least talking points or point you in the right direction.
Someone commented asking where you can go back to review what was talked about today. So I did reshare our website, which will have the Zoom slides as well as fast facts in PDF form so that you can download them. In terms of the actual recorded Zoom session, that will be posted by end of day on Monday to our YouTube channel, which I also shared the link to. And for anyone who may have joined late, I am resharing the pre-assessment link. You only need to fill this out once, but if you would like to have a summary of your results at the end from the pre and post assessment, be sure to fill that out and include your name and email address using that link that I just shared.
Yeah, and then maybe Angela, you can talk a little bit about how the newsletter will work.
Yeah, so we will be sending out the newsletters on Thursdays, and it'll just kind of be a reminder if you did sign up for our session. And at the end of this, I'll also include the link to register for next week's session, since you do have to re-register for each session every week. But yeah, so that newsletter will be sent out to our listserv on Thursdays. It'll include an overview of what the topics that we'll be sharing or discussing will be about, and it will also include the registration link as a reminder to sign up, as well as a link to our website, so that in case you didn't have a chance to tune in the week prior, or you want to review any topics or see what the new fast facts include, you'll have a direct link to access all of that.
Yeah, and I see a question about anti-inflammatory diet. So we did in DFEND 1.0 make a fast fact on foods that help with inflammation. And I think we will have sessions on fats and carbs. I think I'll leave it there because it kind of falls under our fad diet discussions, which we had a lot of, and there's a lot of information. So Adrienne, I would suggest checking our fast facts, and if you don't see what you need, we can help point you in the right direction and make sure that we address it.
And a lot of our fad diet topics fall under our nutrition 1.0 tab on our website because a lot of it was covered in DFEND 1.0.
And I will say, Erin or Dr. Howie does have some students that will be starting in the fall, and it will enable us to make a lot more fast facts, I think, on physical activity and exercise. And if you check our YouTube channel, we do have some videos from a former student over this summer, Alexis Garner, that she had made that are really good, and we do have some fast facts on that. But we will, as soon as we have sort of more staff or health issues, we will make sure to get more physical activity and exercise information posted as well.
And another thing I was going to point out is I did create a fast fact this week on recommendations from the dietary guidelines on approximately how many calories you should be eating, because it actually is dependent on how physically active you are, and they do define what is considered sedentary, moderately active, and very active. So I can link that fast fact here, but it also is available on our website. So there's that. And then Dr. Baum did mention how you do have to pay attention to like good sources of nutrition information. And in Nutrition 1.0, we did discuss where you can find like reliable information for nutrition advice versus, you know, just what's on Facebook and social media that can be not presented by experts. So you can check out that fast fact, and I will also link that here. And there's also a YouTube video that I will link if you prefer video form.
So I think Pam's question about diverticulitis. So I would say I really don't know much about it. And since we're not medical professionals, I hate to say what's good or bad. But if you have someone in your county that has a specific, you know, request, we can try to point you guys in the right direction. But for really disease specific things, the Mayo Clinic's website actually does do a pretty good job of giving easy to digest pointers for those things. Okay, yeah, so I feel like it's probably too complex for us to answer and defend. But we appreciate everyone taking the time to call in today. Hopefully we'll see you over the next few weeks, and don't forget to do that pre-assessment. Thanks for your time, and see you next, I guess, Friday. Thank you.